Hello everyone, I hope you're having a great day. Today we'll be discussing about the honeymoon phase in diabetes mellitus type 1. I think it's better for us to go through what type 1 DM is before we proceed into today's topic. Type 1 DM or diabetes mellitus is an autoimmune disorder where basically our own body cells, specifically the WBCs, white blood cells, attack the beta cells found in the islets, which are responsible for insulin production. So when about 80 to 90% of the beta cells have been destroyed, it is followed by the onset of hyperglycemia. But I have to say, some sources claim that the onset occurs when 60 to 80% of the beta cells have been destroyed. But anyway, and this is actually the point where insulin injections are introduced. So, the honeymoon phase. It's also known as PCR, the partial clinical remission phase. It is a period where the remaining beta cells produce or release insulin, controlling the sugar level in our blood. On average, it lasts for 3 to 12 months. However, it differs from one person to another, so it might last from weeks to years. Therefore, it's really important to keep in mind that this phase doesn't last for long, so it shouldn't be labeled as cure. It just means it's easier to manage to regulate your blood sugar level. If you're wondering whether all type 1 diabetic patients go through this phase, unfortunately, the answer is no. Some studies in Germany and Austria, for instance, reported the prevalence of this remission phase as high as up to 71% in children and adolescents. Some studies stated the prevalence is approximately 50%. So, what are the possible mechanisms postulated that lead into this remission phase? Firstly, it could be decreased hyperglycemic burden, that is due to decreased glucose toxicity. So, prior to the introduction of insulin injection, the beta cells are overwhelmed and exhausted as there will be a consistent hyperglycemic stimulus. However, this state tends to change, that is, the beta cells recover when insulin treatment is initialized, regulating the glucose level. The second mechanism is due to increased insulin sensitivity. Before an individual is diagnosed with type 1 DM, insulin secretion and insulin sensitivity are remarkably lessened due to the hyperglycemia state. But when this condition is maintained well, it reverses insulin resistance. Certain types of signaling proteins, such as interferon gamma and group of cytokines, interleukin 10 and 1R1, are evidently found to be in lower levels during this phase. And the other point is anti-inflammatory cytokine receptor antagonist is linked with a higher level of C-peptide or improved beta cell function. And I think it's also worth mentioning that studies have reported an increase in islet antigen-specific producing cells in new onset type 1 DM to be associated with an improved glycemic control. So, reduction in cytokine profile or inflammatory response is believed to lead into this partial remission phase or the honeymoon phase. A report stated that an individual during this phase had a high glucose transport at cellular level in the peripheral tissue or the adipocyte by insulin action, which was not seen after the remission phase. So the fifth mechanism is due to decreased glucagon production. The general function of glucagon is to provide the body with glucose through different many ways, which in this case in diabetes we are not in need of more glucose, so a decrease in glucagon production is important to keep the glycemic level in control. Here the glucagon production is suppressed by intra-islet insulin production and release. I'm not going to dive deep into this mechanism. I think we shall cover that in another lecture. But just to go through what it means, this factor, the immune mediator and genetic markers, are predictors of the duration and even occurrence of the remission or the honeymoon phase. So, for example, the frequency of CD4, CD25, and CD127, which are the subset of memory T cells, are known to decrease the rate of progression in type 1 DM. And we've discussed about this in the cytokine profile and the reduction in inflammatory response mechanisms, so I'm not going to repeat that. But the other one is microRNA. So these circulating microRNAs are deemed to be an indicator of residual beta cell function after after diagnosis. Even though the word remission implies an unpositive stand in infectious diseases such as tuberculosis and urethral tract infection, the remission phase we're discussing now has a great significance, be it short term or long term. So it reduces the macro and microvascular complications such as diabetic retinopathy, diabetic nephropathy, diabetic neuropathy, or the macrovascular complications such as ischemic heart disease, cerebrovascular diseases, stroke even, and peripheral vascular diseases. And it has reportedly a reduced risk to the development of diabetic retinopathy. It also reduces the risk of being in hypoglycemic state or the diabetic ketoacidosis state. This phase is so crucial for prepubescent children because there might be an increase in structural growth. Improvement in long-term glycemic control is also one of the significance, and there will also be a significant improvement in long-term cardiovascular health. That's all for today. Thank you for watching. Please don't forget to comment any topic you think we should cover. And of course, don't forget to subscribe. See you next time.